Welcome to today's video training conference. I'm your moderator, Gail Holcomb. Whether you're a healthcare provider, an insurer, an agent, or a consumer, indeed, when it comes to healthcare, the times, they are a-changin'. Since the Patient Protection and Affordable Care Act passed in March of 2010, healthcare financing and delivery has been at the forefront of the national dialogue. No doubt it's a highly charged topic. We're looking beyond the politics, and we want to take a hard look at how reform will or won't be implemented. Today's program focuses on how the financing and purchasing of health insurance will change beginning later this year, and how the delivery systems for healthcare are changing. No matter who you are or what your role, these are things you will need to know to stay competitive in our industry. Our panelists today are Gerald W. Fry, President and owner of the Benefit Services Group, Inc. in Pewaukee, Wisconsin. Jerry has over 30 years of experience in the employee benefits industry and is clearly a thought leader in our nation's healthcare debate. Thank you for coming, Jerry. Arthur B. Taquino is an assistant professor at the American College. Art has developed the curriculum for courses behind the college's Healthcare Reform Studies certification program. Thank you, Art, for joining us today. We spent the first hour on the Affordable Care Act. Let me start with just a little bit of background. Remember that the Affordable Care Act is really about insurance, but the issues we're talking about today are much larger than just the insurance, right, Jerry?
Yeah, I think that's certainly true, and my goal will be to try to give you a much broader idea of what's happening in the medical care market or healthcare market in the United States in general. So first we're going to talk about some external changes. The obvious one, the thing we talked about the first hour with Art, and that's the Healthcare Reform Act. But there are other changes. Employers have been initiating some very large changes in the healthcare system over the last few years by instituting cultures of wellness, putting in wellness programs. On-site clinics have exploded in many places. There have been large efforts for coalitions to get together and try to do value purchasing. That's where you purchase based on outcomes or some kind of agreed upon value ahead of time rather than just transactions paying for each service. And so there's a lot of that kind of external activity. There's also some very large changes happening within the medical care provider systems themselves. And so the providers are vertically integrating. That means that what you're seeing is many private practitioners are in fact selling out and becoming part of these large systems. People like Mayo Clinic, Duke University, Aurora Healthcare in Wisconsin, Geisinger, Intermountain, they're all over the country, and we could name quite a few. The point is that these larger integrated health systems that provide a lot of the care along the entire continuum of care, from nursing home all the way down to routine office visits, are becoming much more common. And as a result of that, there are some significant changes in how care is delivered. We'll also look at medical knowledge. Most specialists in the medical field will tell you that they have difficulty keeping up on the updates in their own specialty in the published literature, let alone all the things going on in medical care. And we have genomics, proteomics, we have biologically engineered and genetically engineered medicines. There are just a lot of very, very fast technological changes that are happening inside the medical system that are also changing how we get things done in medical care. And then we've got the whole situation of the wealth of data. Many people have said, as we start looking at some of the things employers are doing, they're going to more primary care models, sometimes called primary care, patient-centered medical homes. On-site clinics are primary care models. Those kinds of things that it feels like we're going back to the HMOs of the 90s. And of course, as a country, we had kind of a bad taste for that. However, when you look back, the only time that healthcare expenditures in the U.S. were relatively flat in the last 40 years was that period of HMO development in the 90s. So many of the ideas that they had back then were good. They were sound. They were just poorly executed. and maybe even executed by some of the wrong parties. And so this time, there's a significant difference when you look under the hood, because for one thing, there is substantially more data available.